FTT, that is failure to thrive. So this term failure to thrive, it includes infants and young children who fail to grow and gain weight due to caloric deficiency without any other obvious cause. So this is the definition of FTT, which goes like FTT includes infants and young children who fail to grow and gain weight due to caloric deficiency without any other obvious cause. So the diagnostic criteria for FTT includes either weight that is persistently below third percentile for age, or weight that is less than 80% of the expected weight. So out of these two, if any one is present, then that is diagnostic of FTT, that is failure to thrive. So there are two main types of FTT. They are organic FTT and non-organic FTT. So the causes for organic type of FTT. Causes for organic type of FTT include gastroesophageal reflux, malabsorption, mental retardation, cerebral palsy, renal tubular acidosis, congenital heart disease, hypothyroidism, diabetes mellitus, infections, genetic disorders, lead poisoning, etc. These are the organic causes which can lead to organic type of FTT. The non-organic FTT is due to various causes like poor nutritional intake, poverty, misperceptions, lack of breastfeeding, feeding diluted formula, maternal malnutrition, social and emotional deprivation, maternal psychological illness, etc. And the most common cause for failure to thrive is poor nutrition, which is one of the cause for non-organic type of FTT. So the clinical features of failure to thrive include poor growth, and development will be delayed, and cognitive functioning will also be delayed, and the child will have an expressionless face, and there will be a poor voluntary motor activity and delayed vocalization. So these are the main clinical features of failure to thrive. And regarding the diagnosis for FTT, the FTT is purely diagnosed based on history, physical examination, anthropometry, growth charts, and investigations. So hemogram is done to rule out anemia and chronic infections. Urine examination is done to rule out UTI. Stool examination is done to rule out infestation, malabsorption, etc. And LFT is done. Then thyroid function test is done, which measures the levels of thyroid hormones, that is T3, T4, TSH, to rule out for hypo and hyperthyroidism. Then tuberculin test and X-ray chest is done to rule out TB, and liver functioning test is done. Then BUN and serum creatinine levels are measured. BUN is blood urea nitrogen. Then serum calcium, serum phosphorus, serum ALP. These three are measured to rule out rickets, which is due to vitamin D deficiency. So these are some of the diagnostic workup for a child with failure to thrive. Then the treatment includes, especially the treatment for FTT is focused on etiology and the associated comorbid factors, and the psychosocial cause should be treated first. And FTT can be mainly treated with dietary management, and the dietary management includes increasing the calorie intake by 120 kilocalories per kg per day, and we have to supplement with vitamins and minerals, and then we have to stimulate the child, and the child should have a regular affectionate interaction with parents, and the organic diseases, that is the causes for organic type of FTT, if any are present, should be treated first. That is the most important part of the treatment. And after doing all these modalities of treatment, if still there is no improvement, then we have to hospitalize the child, and interdisciplinary evaluation is done. The complications for failure to thrive include growth retardation, developmental retardation, and learning difficulties.